Historically, child victims of abuse in central Minnesota were shuffled from agency to agency to be interviewed about the allegations. Jane, age 7, would tell her teacher she is being heard at home. Her teacher would have her talk to a school social worker, a principal, and a school nurse. She would talk to each person about her experience. A report would be made to Human Services, who would then contact law enforcement. Jane would go to the police department to be interviewed by an investigator in a non-child-friendly environment. Jane would then be brought to the emergency department of the hospital to have a medical exam completed. There, she would speak to another nurse and social worker and be examined by another medical provider. Jane would then be referred to the metro area to see a medical provider that specializes in child abuse. She would tell her story to another nurse and medical provider and be re-examined. On a different day, Jane would have to tell her story again to a child protection worker. A prosecuting attorney would also need to talk to Jane. Jane would be referred to a mental health professional, where she would be asked to tell her story again. With each telling of their stories, children were re-victimized by the very system that was supposed to protect them. This led to children feeling as if they weren't believed.
The Central Minnesota Child Advocacy Center started when CentraCare approached the criminal justice system. They first approached me as the chief prosecutor, the Stearns County attorney, and said, we're seeing a lot of the same people that you are. The people who end up involved in the criminal justice system also end up with a series of health events happening in their lives. And what they taught me was that a lot of that is based on something called ACEs, the Adverse Childhood Experiences Study, which talks about if things happen in people's lives that are highly stressful, that are traumatic, something happens that just shouldn't have happened, that will affect you in ways that you might not realize. Later on, that might cause issues with your heart, issues with your blood vessels, issues with just different things that are going to affect your life. So we came together and started talking about how we could help with that. And when bad things happen, what can we do to make sure that those long-term effects are as minimal as possible? And about 3 months after we started talking about that with CentraCare, the legislature called me and said, hey, we have some money available to start child advocacy centers, and we'd specifically like one in central Minnesota. And the partnership that then we formed with CentraCare, social workers, law enforcement, prosecutors, child protection professionals, to work with kids and work with families to make that a positive thing in the long run, so that whatever bad has happened can stop right here and we could move forward from here and not have long-term effects. And it's been one of the most meaningful and effective partnerships that we've ever created.
The Child Advocacy Center model was developed in 1985 when a district attorney saw the need to create a better system to help abused children. At the time, the criminal justice and social service systems were not working together in an effective manner that children could trust, often adding to their emotional distress. This created a segmented, repetitious, and often frightening experience for children and their families. The Child Advocacy Center model includes a multidisciplinary team of professionals who work together to investigate and respond to allegations of maltreatment. This ensures all service providers are involved from the beginning and that individuals get all the necessary services in one location, one time. This can prevent re-traumatizing the victim, alleviate stress on the family, and ensures consistency of services to produce positive outcomes for the case. Our Child Advocacy Center's mission is to provide protection, advocacy, justice, and healing for victims of abuse in central Minnesota. We carry out our mission by providing forensic interviews, medical examinations, advocacy, and mental health services. We also provide community outreach and training, prevention education, and medical examinations for children in foster care and high-risk youth.
A referral to the CAC is made from child protection or law enforcement when there is an active investigation of child or vulnerable adult maltreatment. CAC staff coordinates the visit with the appropriate MDT members and the family. On the day of the child's visit, the family is greeted by a CAC staff member. One of the first steps of the process is for the child to meet with a professional who has specialized training in interviewing those who have experienced maltreatment. Children are asked questions in a manner that encourages open dialogue. The interview is person-centered and is designed to hold up in court. The interview is recorded and observed by a group of professionals on the multidisciplinary team, or MDT, in a separate room. Together, they can share information and plan next steps of the investigation to ensure the child's safety and healing moving forward. Because the number one factor in an event being traumatizing to a child is how their caregivers respond, the CAC offers support to the non-offending caregivers while the child is in the forensic interview. Caregivers are offered ongoing education and support by the child and family advocate to ensure they remain informed throughout the case. The advocate can also assist in getting the child and family access to mental health services and other helpful community resources. After the forensic interview, each child is offered a thorough exam by a medical provider who has expertise in working with children who have been abused. The exam provides the child reassurance that their body is okay and healthy. The child is in control of the exam, and the provider encourages questions throughout the exam. This is an essential step in beginning the child and family's healing process. The medical exam may also provide evidence of the abuse, and may find that the child has unidentified medical issues, such as developmental delays or dental issues. Appropriate referrals are made to ensure the child's overall medical health. Children are provided a mental health screening to identify how they are currently coping. If appropriate, the child may see a mental health provider following their interview and medical exam to further assess mental health symptoms and learn about coping skills. Trauma-focused mental health referrals are often made for the child to begin their healing process. After the medical exam, the MDT meets to share information and plan next steps for the case. Team members discuss recommendations with the family to ensure they are included in the process.
Families served by the Child Advocacy Center will never receive any out-of-pocket expenses for the services they receive. Funding of the Child Advocacy Center is provided by CentraCare, counties served, grants, and donors.
With a CAC response, Jane would have one interview in one place, one time, and get connected with additional resources to start her journey of healing. The Central Minnesota Child Advocacy Center hopes to continue their mission of providing protection, advocacy, justice, and healing to abuse victims and their families in Central Minnesota.